Good afternoon, everyone, and welcome to our webinar, Recruiting Overseas Doctors in the ACT. This webinar is part of a two-part series. So today's webinar is tailored to practice managers and principals to understand the requirements involved in recruiting doctors from overseas. The second one, held next Thursday evening, aims to help international medical graduates to navigate the pathway to general practice in the ACT, which you are also welcome to join. Before we get started, I would like to acknowledge the traditional custodians of the land on which we meet today and pay our respects to elders past, present, and emerging. I also extend that respect to any First Nations people joining us today. This series was created to support the growing workforce need in the ACT. As more practices look overseas to recruit doctors, we understand how challenging and complex that process can be to navigate, especially for busy practice managers. We hope that today will provide some clarity as we share some key information and guidance in one place. My name is Katarina. I am the Quality Improvement Project Officer here at CHN, formerly the Workforce Planning and Prioritisation Project Officer. I'm joined by Dr. Adnan Alam, our GP advisor, and our wonderful events lead, Kunal. Our guest speaker today is Rakesh Patel, the Workforce Program Coordinator at a neighbouring PHN, Nepean Blue Mountains PHN. With over a decade of experience strengthening the primary care workforce in the Nepean Blue Mountains region, Rakesh supports general practices and healthcare job seekers with recruitment, retention, and succession planning for their GP workforce. His expertise spans both local and international medical graduate GP recruitment, using his extensive knowledge of distribution priority areas, area of need designations, Medicare provider number legislation, and GP training pathways. Change slide, please. So here is our agenda today. We've got a bit to get through, covering the areas involved in recruiting overseas doctors. For some housekeeping before we get started, all participants have been muted today. Please ask any questions in the Q&A section, so the little Q&A box, and not the chat box on the side panel. We will have a Q&A session at the end for any questions that you have. This presentation will also be uploaded to Capital Health Network's YouTube page, and you're welcome to share it with your networks. Please change the slide. So as for, we're just going to brush over the ACT regional profile in case you aren't familiar with Canberra. We've got 646 GPs in the ACT, about 111 general practices and 11 GP catchments. When it comes to recruiting overseas doctors, different rules do apply to different regions, which we are going to break down shortly. So now I would love to welcome Rakesh.
Sorry, Kat, can I just pause for a second?
Yeah.
It looks like there's some issues with the screen not being visible to some of the participants. Can we look into that, Kunal?
I think so. I reckon it should be fine now.
Okay, so if there's any issues still, please respond in the chat and
Yeah,
we can have
please
another look at it.
Yeah.
Sure.
Someone says I can see it fine now.
Yeah.
Right, thank you.
Great, thank you, everyone.
Perfect.
All right.
Thank you, Katrina, and thank you, Adnan, for pointing that, because we don't want to start the discussion when people can't see the screen. But thank you so much, Katrina, for that welcome introduction. And thank you for planning this webinar. And I'm sure people will be able to find it useful. So let's start. So basically, GP recruitment is a complex process, especially when it comes to the overseas trained doctors, because there are specific legislations and requirements that the doctors and the practices have to fulfill to make it working. And the process itself can take some time. So I'll start with the first slide, and it's about the distribution priority area, MMM, and area of need. Some terminologies that we commonly use, but it's good to just clarify what they mean and how they are useful in the entire process. So starting with the distribution priority area, some of you may have heard about a word called District of Workforce Shortage before many years. So that was the word being used for the general practices in the past, but before 3 years, it was changed to distribution priority area for the GPs, and the DWS word is kept for the specialist, non-GP specialist, classification. So DPA is a classification that is available for any area in the country which has lower levels of GP services compared with a national benchmark level. And now that national benchmark level is decided by the government. This DPA classification is very useful, especially because the international medical graduates can access the Medicare billing for DPA locations. So looking at the regional profile of this particular PHN, all catchments except North Canberra, South Canberra, and Wooden Valley are distribution priority area. So that means if you are belong to any of the other catchments other than three, you are distribution priority area, which is a good thing to have, especially if you are interested and planning to recruit overseas trained doctors. Now, this classification updates usually in August, November. So that's just something to keep an eye on. We have a link at the end of the presentation where you can go to that link and you can put your address and it will tell you whether you are DPA or not. Modified Monash model is the rurality scale. It can go from MMM1 to 7. And as you can see on the slide, all GP catchments in this PHN are MMM1 except for one catchment, which I believe doesn't have a lot of people, living into that catchment. Now, MMM1 is good. However, MMM2 to 7 has specific benefits because they are rural. So when you go from MMM1 to onwards, the rurality changes. And if you are in MMM2 to 7, that brings some benefit, especially to recruit the doctors without fellowship. Um, there is a new program called pre-fellowship program, which was launched last year, which allows doctors without fellowship in MMM1 area for limited time. So we'll talk about it later, but it's an important program that you need to consider because as majority of the practices in this PHN is MMM1, when you are recruiting a doctor without fellowship, this particular program, pre-fellowship program, might be very helpful. Not for a long term, but only for a 2 or 3 years, and we'll talk about it later. And it updates with census, so we can't change the classification. It just decided by the government. Area of need is another classification which is a process. So the practice is in distribution priority area. They need to apply to become area of need, which will help them to recruit doctors on limited registration on area of need pathway. So it's a good approval to have. However, it doesn't give you 100% benefit. A lot of practices have misunderstanding that if we are area of need, we will be able to recruit anyone and everyone, but that's not the case. And we will talk about it in the next slide. Just keep an eye on the table which Katrina and Adnan has prepared. Please identify the GP catchment that you belong to and take a look on the DPA and MMM classification for your catchment, because the next slides and the entire discussion will be based on those two things. I'll keep it for 5 seconds and we move on to the next one. So now this slides will actually will inform you about the two important legislations that decide the doctor's eligibility to get the provider number for any location. So not only for your location, this will be applicable to the entire country. Two legislations, Section 19AA, which is about the permanent resident or citizen doctors without fellowship of RACGP or ACRM. Now that law requires the doctors who have permanent residency or citizenship but does not have fellowship, they have to work under specific GP training programs under that particular legislation. So please keep an eye on that one if you are recruiting a doctor without fellowship. And as you can see, all these GP training programs which are eligible under Section 19AA are mostly rural based. When I say rural, MMM 2 to 7 locations. However, Australian General Practice Training Program is a really a good program where you see all these GP registrars coming through the colleges. That's where Section 19AA is also available for MMM1 location like yours, like the PHN, the Capital Health Network PHN region. We won't go into the details of all these programs, but please do some research about the program. As you can see on the left side of the screen, as mostly rural fellowship support program, RVTS, practice experience pathway, independent pathway, and approved medical deputizing service program. Now, Section 19AB is about recruiting overseas trained doctors. There's a thumb rule that whenever a doctor from overseas comes to Australia, for the first 10 years of their initial Ahpra registration, they have to work into distribution priority area. So as I said in the first slide, that DPA status is very important whenever you are recruiting an overseas trained doctor when they are in that first 10 year, which is also labeled as 10-year moratorium. So you might come across doctors who will say, I'm still in moratorium, or I have finished my moratorium. That's what it refers to. So being a DPA classification for your practice location actually helps to fulfill the 19AB requirement to get the 19AB DPA exemption. Now, if, and I believe three catchments are non-DPA. So if you are one of those catchments, then there are some specific exemptions which are available, even though you are not DPA. As you can see, spousal exemption, after hours exemption, local exemption, replacement. These are also important things for you to know whenever you are, recruiting an overseas trained doctor. They are not easy to get. However, if the doctor is eligible for one of them, there is still a good possibility. The important one I want to highlight into this section 19AB, especially for the non-DPA location, is when you receive an inquiry from an overseas trained doctor, please just don't rule them out straight away. Check their CV, see if they are eligible for any of these special exemption. Do some inquiries. You can ask the PHN, you can send an inquiry to the Department of Health section 19AB section, and we have an email address for them in the last slide. And check if this doctor that you are planning to recruit is eligible to get any of these exemptions, because being non-DPA, this is still possible. So just keep an eye on that one. And I think we have a case study at the end to talk about. Just one more thing before we move on to the next slide. Australian National University international graduates, they are also subject to the DPA requirement. So even though they have studied in Australia, if they were overseas, if they born overseas when they started their med school in ANU, they will be subjected to the section 19AB. So they will still have to work into the DPA locations. So that's just a special case for you to consider. Now, this is a kind of process flow. Let's say you received an inquiry from a doctor, and I'm sure practices, you guys are already advertising on various websites or platforms to attract some doctors for your practices. So what I would do is always check the doctor's eligibility to get the provider number as the first step. Because I have seen practices starting the Ahpra registration side initially, not realizing that the doctor may not be eligible to get the provider number. And it could be a difficult situation because a doctor has spent 6 months, 9 months to go through the medical board, got the registration. When they are ready to get the provider number, it's decided by the Medicare or departments, oh, he's not eligible. So the entire process and the effort which has gone to get the Ahpra registration is completely wasted. So my advice to all of you is to check the doctor's eligibility as the first step before you start that recruitment journey. Now, on the right side, as you can see, some optional things, of course, up to you. Recruiting a doctor is like recruiting any staff. You request their CV, you interview them, you check their Ahpra limitations if they are already registered, police check, all these things. Optional, but I will recommend you to do that, because that gives you some surety that you are bringing the right doctor for your practice. Now, four things on the left, as you can see, important things. So any inquiry that you receive, ask for these four things, which is whether the doctor is overseas trained or locally trained, fellow or non-fellow, what is his residency status, are they PR citizen, PR is permanent resident, citizen, or they are temporary resident on some kind of visa, or they may still be overseas, want to come here on some kind of visa sponsorship. These, and the last thing is whether they have Ahpra registration or they are eligible to get one. These four things will decide the entire process, how long it is going to take, and what will be required, and everything that will be decided by these four things. So for example, overseas trained, locally trained will decide whether the doctor is subject to the 10-year moratorium or not. The other two, fellow, non-fellow, and residency, will decide whether the doctor is subject to the Section 19AA, which we talked before. And also the residency status will also decide whether there will be any visa sponsorship requirement from the doctor that you need to help them with. And of course, the registration research will also help you decide what's the category of registration the doctor has, or what category of registration the doctor is eligible to get. Moving on to the next slide, and this is very
That's halfway,
complex.
Rakesh. Just letting you know.
Perfect, perfect. Thank you. I think we are going on
You're
time.
going well on time.
Um,
Yep.
this is a very complex slide, and as you can see the disclaimer, this is for a general purpose. Please always check the individual doctor circumstances, their eligibility, and special exemptions based on their family, medical, or extenuating circumstances, and do not use this table as your decision making. This is just a guide for you to understand, what type of doctor that you are recruiting and what is the requirement in terms of the location. I won't go into the detail, but as I highlighted the first one, it says permanent resident citizen, locally trained doctor with fellowship. That means a doctor from Sydney University who has gone through the AGPT and now got the fellowship of the RACGP, fully qualified, no restriction. He can work anywhere. There is no requirement for DPA. There is no requirement for modified Monash Model 2 or onwards. So that's just your first priority. Any practice in this country wanting to recruit a doctor, they will be, prioritizing this particular category. So you need to understand how competitive you are, because a practice in Sydney CBD may be recruiting the same doctor. So, this, if you have a lot to offer to this particular doctor, of course, if the doctor wants to make this area as their home, most welcome. However, this particular group is very difficult to target or attract, especially for non-metro kind of locations. And there is some other categories that we have identified, Katrina, Adnan, and I have gone through different scenarios and thought, what type of profile, the doctor's profile that the practices can come across. So that's the list on your left side of the screen. So just keep an eye on this one. And I believe this presentation will be shared after this. So you can always refer this at a later date. Now, going on to what we discussed so far is about the provider number eligibility. That's important. And I forgot to mention one very important thing. If you are into a distribution priority area today, and if you are talking to a doctor who is overseas trained today, please make sure that you communicate everything with this doctor via email. The reason for that is, I give you an example. Let's say you are DPA today and you are talking to a doctor from India or Pakistan or Sri Lanka today. That means you have DPA and the doctor will require DPA. Perfect. That's great. Now you are telling the doctor, okay, go to the medical board and get your registration and we will recruit you. However, imagine next month the DPA classification is changed and you lose your DPA status. So you are no longer a DPA after a month. And the doctor who you were talking today comes to you after 3 months and say, I got my registration. Can you apply for the provider number? And you go to the Medicare and they say, oh, but you are not DPA. We can't give you the provider number for this doctor. It's a failed journey. To prevent that, what I recommend is, if you have negotiated with this doctor today while you are distribution priority area, that evidence of communication, negotiation, whether it is email, whether it is a practice visit calendar invite, whether it is a formal contract that you are doing with the doctor, all these things can be considered as proof of negotiation when the practice is DPA. So even if you lose your DPA status in 1 month time, you could still continue recruiting this particular doctor that you are talking today, even if you are not DPA on that day. So a gold advice from me, that any doctor that you talk or via phone or email, just maintain your proof of negotiation, emails, any communication you do, just save them into a folder until the doctor gets the provider number and ready to start working. Moving on to the registration pathway, these are the different pathways that are available, and we won't go into the detail. The thing that I want to highlight is the self-assessment tool. As you can see on the right side, there is a link. um, if you come across any doctor and not sure which category of registration the doctor is eligible for, click on the link, ask the doctor, or even you can do it. Ask them to complete, every question that is asked. It will tell at the end that this is the best possible registration pathway for you. Now, I think Adnan wanted me to specifically target about this expedite specialist, the SIM. So the Specialist International Medical Graduate pathway, which opened up last year. It's a really good pathway which makes doctors from specific countries with specific qualifications directly eligible to get the specialist registration. It's a wonderful opportunity for you to target the doctors from those countries. And I think I have a note here, Ireland, New Zealand, and UK. These are the three countries. If the doctor has a specific, specialist qualification from Ireland, New Zealand, or UK, they may be eligible for this Specialist International Medical Graduate pathway, which is number fourth on the table, as you can see on the screen. That's the perfect opportunity. The doctor will still require some supervision. However, they will be able to get the specialist qualification without going through the exams or assessment or anything. Perfect pathway, very quick, and you can get the result in as soon as like 1 or 2 months, or maybe even shorter time frame if all the boxes are ticked. So please refer to the self-assessment tool on Ahpra website to decide the category of registration the doctor is eligible. Um, now, we won't go into the detail, but as I said before, and I will remind again, check the eligibility for the provider number first, and then come to the Ahpra registration self-assessment tool. Moving on to the next one, visa sponsorship. You may come across doctors who want some kind of visa sponsorship. It's a complex process, and I would highly recommend you to engage a registered migration agent, MARA. The link is on the screen. You may find someone local because they will help you to go through that process and sponsor the doctor. You can do the entire process yourself. However, it's complex, and that's why the specialist migration registration agents are there to help you. They will charge you some fees to do that. However, I think it will really be helpful. It will save a lot of your time and uncertainty, and helping the doctors and you to go through that entire process. Moving on to the important side, now you have decided the doctor's eligibility. The doctor has gone through the Ahpra process, PESCI, the AMC exams and everything. Now he has the provider number. He's ready to work in your practice. Now this part is something where many practices miss out. You know, important things. You need to provide a practice tour, the introduction, local area guide, everything. Imagine a doctor, and I put that in the slide. If a doctor is coming from an overseas country, highly populated country or a town where there is a completely different system, a referral system is totally different. They have a lot of tertiary support available in those countries, and you recruit them for your practice into a small outer metro location, and the tertiary hospital is a little bit far from you. How would you feel if you are the doctor, and you have been placed into a location where the entire system is totally different what you used to in your home country? That is why all these things are very important, that you support the doctor, not only the doctor, I would say even the family, because that is something that will help to retain these doctors into your practices. Very important. And I won't go into the detail, but as you can see, that there is lot that you can do and offer to the new doctors who is new to the practice, new to the area, or even new to the country, or the state. Well supported doctor is a well performing doctor. And I'm sure you will all agree with that particular sentence that I we come up with. Welcome pack, very important. Practices. You put a doctor into your practice day one, give them all the resources. If possible, I will recommend you to have that first half day, no patients, just give them orientation about the practice, where is a nearby hospital, how you can refer, where is a nearby physiotherapist, how you can refer, what's the software, lot of things that you can provide and offer to the doctor in that first half day on their first day. So please consider these, when you are recruiting the doctor. Now, Catherine, I hope I covered everything. Adnan, please remind me if we have missed anything important before we go on to the case studies.
I think that was
I think
fantastic,
that was great,
Rakesh.
Rakesh. Yeah, I think you did really well and covered most of the topics. And obviously, we'll be sharing these slides as well with everyone later on. And there are a few question and answers that we've got, a few questions sitting there that I'll pass to you when we get to the Q&A time. Some of these might be covered in your case studies anyways, but we'll cross that bridge when we get there.
Perfect.
Awesome. So we're going to move on to case studies, and these reflect real inquiries that we receive in the ACT. So hopefully are going to be of help to you today. So let's move on to the first case study. We are a practice located in South Canberra looking to employ an overseas doctor from Bangladesh with level 1 supervision. They've completed their PESCI exam and are preparing for Ahpra registration. Can we hire them, and what are the steps we need to take? Over to you, Rakesh.
Perfect. Thank you, Katrina. This is a really good case study because I'm sure many practices will come across similar kind of profile from a practice and also from a doctor's point of view. So let's move on to the methodology that I discussed in the previous slides, and let's see how we can use the same process and thinking to tackle this particular case study. So you may be able to see the screen where it says, how I said the 4 things that you need to consider while recruiting any doctor. So overseas trained, locally trained, fellow, non-fellow, residency status, and their Ahpra situation. So the summary, what case study says is an IMG from Bangladesh with AMC1 and PESCI wanting to work in non-DPA MMM1 location. So I think it was about South Canberra, but this is pretty much common to any non-DPA MMM1 location that you belong to. Now, in that case, let's see what are the answers that we are getting from the question itself. Overseas or locally trained? Yes, overseas trained because the doctor is from Bangladesh. Fellow, non-fellow, doctor from Bangladesh, very likely 100% is non-fellow because he never been to Australia, and Bangladesh is not one of those countries which are eligible for those expedite pathway that I mentioned, Ireland, New Zealand, UK, or some other countries which have some other options. So non-fellow. And then residency status, not sure. So that's the question you need to ask. Are you still in Bangladesh? Will you require a visa sponsorship? So I put not sure there. However, very likely that the doctor will require some kind of visa sponsorship. Registration, again, the doctor is from overseas, not eligible for specialist registration. So very likely that the doctor will start on a standard pathway, which means a limited registration that he will be eligible to get based on the Australian Medical Council MCQ and PESCI and all those exams. So this is our case study. These are the questions that we want to find out, and these are the answers which we can get from the case study itself. Now, let's think about the process. What I said in the before, that first thing you need to decide is the eligibility of the doctor to get the provider number. Now, if you remember, the first thing I said is the 19AB requires any overseas trained doctor to work in the distribution priority area for the first 10 years of their Ahpra registration. That means without even thinking anything else, this doctor from Bangladesh will have to work for 10 years into DPA location. For 10 years, not a short duration, 10 years. Now, the information that we have for this location of this practice, South Canberra, it's not DPA, it's MMM1. What that means is Section 19AB will be failed. The doctor will not be able to get the Section 19AB exemption because the practice is not DPA. However, it's not the end of the world. As I said before, now you need to go further in depth about the doctor and his specific circumstances. Is he eligible for any of the other special exemptions that I mentioned? And I will quickly go to that slide just to remind you what exemptions they are. right here. On the right side, there's a box, spousal exemption, after hours exemption, locum exemptions. So you need to now go into the doctor's CV in depth to decide if the doctor has any of these special exemptions are available. If that's the case, then yes, you can potentially consider that the doctor will be able to get Section 19AB exemption with one of these specific exemptions which are available. However, please do remember that most of these exemptions are based on the doctor's individual and family circumstances. So there is little that the practice can do to change or modify to get eligibility, for these exemptions. It's mostly about the doctor himself or herself. Um, Please consider that. So generally speaking, a doctor from Bangladesh or any other country overseas not eligible to work for a non-DPA location. So unfortunately, 99% of cases, this doctor will not be able to get the provider number for this particular practice. However, if the special exemption are available and possible, we could explore some possibility. Now, when we have decided the doctor's eligibility, we don't even need to worry about other things, the Ahpra, the visa. So please don't jump onto the immigration or Ahpra side without checking the doctor's eligibility first. That will help you to save a lot of time and also disappointment at a later stage if you haven't done that research. Does that cover the answer, Katrina, Adnan? Should we move on to the next one?
Yeah, that was really clear. Thank you for taking us through that, Rakesh. We'll go to the next one.
Perfect. Thank you.
All right, case study 2. We are a practice located in Tuggeranong, experiencing a workforce shortage and are looking to employ a few overseas doctors, one from England and one from India. What process do we follow?
Perfect. Thank you. So this
There's about
covers
5 minutes for this one, Rakesh.
Perfect. Thank you. I will finish it in 5 minutes. So two different doctors profile that we want to try and recruit for a doctor for this particular practice. Now, let's go to the same approach. The summary, MMM1 DPA practice into this particular location, wanting to recruit IMG from UK and India. As you can see, I have identified the answers into the middle section. Both doctors overseas trained. Indian doctor, not fellow. UK doctor may be eligible. So as I said, Ahpra registration self-assessment tool will help you to decide whether this doctor from UK and his qualification makes him eligible to get a specialist registration and becoming a fellow. So that's something that we need to do the research later on. Now, residency status, apparently both doctors are still overseas. They want to come and work in Australia, so very likely they will be requiring visa sponsorship. The doctor from India, because not eligible for specialist registration, very likely will be eligible for limited registration with their AMC exams. The UK doctor may be eligible. When I say maybe, the reason not all degrees from UK are eligible for the SIMS pathway. So you need to check whether a specific specialist qualification from UK, because that's the only one which is eligible. So whether the doctor has that qualification or not, you need to consider that. So this is our answers to the questions that we want to ask. Now, let's think from a provider number eligibility point of view. The practice is DPA, it's MMM1. Both doctors are overseas. What that means is the doctors coming from overseas, they have to work into DPA location. Practice is DPA, perfect. We don't need to worry about any of those special exemption. There will be section 19AB DPA exemption available and given to the doctor. Only thing you need to remember, as I said before, is proof of negotiation. Make sure you send them email confirming, thank you for sending your CV. We have, we have reviewed your CV. We are happy to meet you over online or face to face, whatever way. Proof of negotiation with both doctors, please do maintain them, because that may be handy if you lose the DPA status in a month time. That's my advice. Now, let's talk about the fellowship and non-fellowship part. This is tricky because the doctors will be coming here as a temporary resident. There is a really nice situation that you can see here. When the doctors enter in Australia as a temporary resident, they don't have to worry about the section 19AA if they get the DPA exemption. This is a really good situation here. The practice is DPA. you will be getting the DPA exemption for the doctors that will help them to automatically bypass the section 19AA, which is applicable on any doctor without fellowship. Perfect. You get the 19AB DPA exemption and you make them enter as a temporary resident on a visa. They don't have to worry about fellowship requirement. Pre-fellowship program, perfect opportunity for you to recruit this doctor. However, please do remember that any doctor that you recruit as a non-fellow, it will not be for a permanent basis. The doctor and you needs to make sure that the doctor will get the fellowship, in future. That should be the ultimate objective of any non-fellow doctor. Because I have come across many doctors when they are working on all these special programs as a non-fellow doctors, and then they become permanent resident without getting fellowship, and they will lose their provider number. So please do consider, this is very important. The doctor that you are recruiting as non-VR on a DPA exemption, they will have to aim to get the fellowship prior to becoming permanent resident, because if they become permanent resident and they don't have the fellowship on that day, they will be subject to the section 19AA of the Health Insurance Act, and they may lose their existing provider number. Not in all cases, but in most cases. So please do consider this as a very important thing for you to keep in mind, that the doctor should aim to get the fellowship prior to becoming permanent resident. So technically, answer to this case study, both doctors can come and work for your practice on the DPA exemption. Now important thing about the Ahpra registration, there will be supervision requirement, especially for the doctor from India. So you need to make sure that you have a supervisor which you will nominate for this doctor, and he is available, especially for the doctor from India. Maybe a level 1 supervision which will require your supervisor to be physically present with this doctor all the time, at least for initial 3 to 6 months. So please do consider the supervision requirement. So yes, technically possible. It will take various steps. So Ahpra registration, the visa sponsorship, the provider number, and finally, as I said, onboarding them, networking them, and all those things. So that's the outcome for these case studies. Thank you, Katrina.
Thanks so much, Rakesh. That was really helpful to put today's learnings into practice. So we have about 7 minutes for questions. Please, write them in that Q&A box. And if we can't answer them today, we'll take them on notice and send out an FAQ afterwards. So I'll hand over to Adnan, who's going to help with question time.
Yeah, thanks, Kat. So there was a couple of questions that I already answered in the chat box as a text. One was about area of need, which is usually governed by states and territories, and I put the link for the application to do that, but you have to be in a DPA area for that. And I guess if you're needing any assistance for that, you can possibly contact the QI team, and Kat's put in there some contact information as well. There's another question, and this is a good segue from what Rakesh was just finishing up on about what level 1 supervision is. So I've just essentially copied and pasted what the requirements are from the Medical Board of Australia website, which is, as you can see, quite sort of onerous. You have to be physically present the entire time, and every patient needs to be sort of discussed with the supervisor. Now, the next question, I might pass this to Rakesh to sort of answer live. So if there's a PR or a citizen on limited registration who wants to do a FSP pathway, how will they sort of go about that?
Perfect. Thank you, Adnan. That's a very good question. So the doctor who is PR or citizen, and as you said, the doctor is already, I believe the doctor is already working. Now FSP, it's called Fellowship Support Program. Now that is one of those 3GA program that I mentioned earlier, eligible for Section 19AA of the Health Insurance Act. So what happened is, when the doctor is permanent resident or citizen, and if he doesn't have fellowship, he will have to work into any of those programs. FSP is a perfect, really good program. I think it's the most commonly used program to fulfill that requirement. However, please do consider that FSP has a modified Monash Model 2 or onwards requirement. So if you are from, I don't know what's the location of this particular practice, but if you are in MMM1, it may not be possible for you to recruit this doctor on FSP. However, if the doctor is already working for your practice because of some special exemption, because there was a different exemption which was available many years before, and I have seen some doctors still working on them before even FSP program was launched. In that case, if you already have a provider number for an MMM1 location, that there may be a special possibility that you can continue on FSP for that MMM1 location. However, very likely that FSP will not be available and possible for MMM1 location. However, if you are MMM2, yes, perfect. MMM2 location, this doctor, permanent resident or citizen, put them on FSP, and that's a perfect opportunity for the doctor to work and also at the same time prepare and pass the exam and become fellow so they can continue to work at your practice for long term. Thank you, Adnan. I hope I answered the question.
Yeah, thanks, Rakesh. So another question we have is someone has an IMG who has Ahpra registration and about to do the visa sponsorship for that IMG. Should this person ask them to apply for the provider number first?
That's a really good question. Now so I believe based on the information you provided, the doctor is not working. He's still overseas. That's just my assumption. So, and also we need to make another assumption that the practice is located in the DPA. So if the practice is DPA, if the doctor is overseas trained, so we checked the eligibility. That's good. Perfect. You have confirmed the eligibility that because you are DPA, you can get the provider number. Now, getting the provider number and getting the visa sponsorship, totally different things. Now, it's important if the doctor has gone through the Ahpra registration and has already got the Ahpra registration, there is nothing that will stop you to get the provider number. However, very likely that if the doctor is still overseas, what he has done so far is only pass the AMC MCQ exam, because for AMC clinical, he would still have to come to Australia and appear in the exam physically, most probably on a visitor visa. So if the doctor has already got the registration sorted, if they have the registration, I think you can apply for provider number. Now that is independent of a visa sponsorship. So please do consider getting a provider number does not guarantee that the doctor will get visa. And opposite also is same, that if the doctor gets the visa, there is no, very likely the visa is only issued when the doctor is eligible. So however, there is still a tiny possibility then the doctor is getting the visa. And if you haven't done the eligibility check prior, and if you're not DPA, and if you have missed that part in the beginning, the doctor may not be able to get provider number. However, as I said, if the doctor has got the registration, you can apply for provider number in parallel to the visa sponsorship. Now, this is a specific area of expertise, so I will again recommend you to engage a registration, registered migration agent to confirm this information. Thank you.
Thanks, Rakesh. The next one is probably more for Kat. So who is the point of contact for advice if an overseas doctor approaches us or approaches
Yeah,
them?
so we'll try our best to help in the QI team. Our email address is listed on the last slide as well. So it's primarycare@chnACT.org.au. There's also some other contacts from Ahpra and the department there as well.
Thanks, Kat. I'm just mindful of the time that we're sort of at time at the moment. We've still got a few questions that haven't sort of been answered yet. Do we want to try? Do people have time to stick around to try and get through those, or should we sort of wrap up and then we can always send the answers in writing off to people?
Yeah, whatever we can't answer today, we'll take on notice. Do you want to just do one last question and then we'll wrap up?
Yeah, sure. So what happens to an IMG practicing in Australia, so non-VR? Can they work in a DPA? They are a PR and a citizen now.
Perfect. That's great. Good. I think it is similar to one of the case study. So let me try to understand. A doctor is non-VR. He is permanent resident or citizen. And the question is whether this doctor can work in the DPA location or not, right?
Yeah.
Perfect. So IMG, that means the doctor will have to work in DPA for 10 years and you are DPA, perfect. However, the tricky part here is the residency, because I believe you mentioned, Arman, the doctor is permanent resident or citizen. Now that will make them subject to the section 19AA of the Health Insurance Act. What that means is a doctor without fellowship who is permanent resident or citizen will have to work into those 3GA programs which are eligible for the 19AA. However, if you remember, I mentioned about a specific program called pre-fellowship program. This is a good opportunity for this doctor to work for your DPA location. So let me tell you a little bit more about pre-fellowship. This is a new program. It allows the permanent resident or citizen internet, doctors who are overseas trained, even without fellowship, they can work into this DPA location, even if it is not rural. So remember I said doctors without fellowship very likely will have to work into MMM 2 to 7 locations if they are permanent resident or citizen. The exemption for that is the pre-fellowship program. If the practice is DPA, and if the doctor is permanent resident or citizen and doesn't have fellowship, rather than him going straight to the rural location, there is a bridge program and it's called pre-fellowship program. So you can get pre-fellowship program provider number for your DPA location for up to 2 years. That process is handled by New South Wales Rural Doctors Network. So what I recommend is contact the New South Wales Rural Doctors Network, tell them that you are DPA location, you have a doctor who wants to work for your practice on pre-fellowship program, and they will help you to go through the entire process and get the provider number. So that's the answer. There is a possibility. Thank you.
Wonderful. Thank you so much, Rakesh. We'll need to wrap up the questions there because we're a little bit over time, but anything unanswered today, we'll make an FAQ sheet and send it to all attendees. This webinar will also be available on our YouTube channel as well, which we'll send out, and the slides will also be sent to you after the session. So thank you all for taking the time out of your day, and to our wonderful guest speaker, Rakesh. Please feel free to join us for our next webinar next week, outlining the IMG journey to general practice, with special guests from Ahpra and the department joining that one. There's a link as well in the next slide for that webinar. Evaluation surveys will be sent out shortly. Please fill in the post-event evaluation survey so that we can email you a certificate of attendance after the event for your CPD. And yes, as I said, it'll all be uploaded and sent out to you. So thank you all for joining us today, and have a wonderful day.